vision, spirit, creativity. Forces that drive discovery and innovation. Forces at work in American industry. Improving life today. Inspiring progress tomorrow.
The surgeons at Pacific Bariatric Surgical Medical Group in San Diego, California, are regarded throughout the medical community as leading experts in the field. Their commitment is matched by the group's support staff, which is comprised of many who are patients themselves. This team is living proof of the program's countless benefits. Members are uniquely qualified to provide information regarding bariatric surgery, as well as encouragement and compassion for patients, their families, and friends. Pacific Bariatric and Scripps Mercy Hospital combined are a nationally designated center of excellence for bariatric surgery by the American Society of Bariatric Surgery.
At Pacific Bariatric, we provide state-of-the-art surgery for our patients that suffer from the disease of morbid obesity. This has been thought to be an uncurable and untreatable disease. And until recently, this disease affected so many people in the United States that could not have treatment any other way. And we provide state-of-the-art surgery and safety for our patients that require this operation.
As we all know, the people that are morbidly obese have a higher instance of sudden death. They have a higher instance of diabetes, hypertension, joint arthropathies, sleep apnea, all of which can improve once they lose their weight. The main successful treatment at the present time is surgery. Multiple medical regimens have been proven not to be successful, at least the ones that we have in vogue at the present time. So surgery for the morbidly obese is really the answer for them to have any long-lasting weight loss.
According to the American Obesity Association, more than 127 million adults are overweight. 60 million are classified as obese. These statistics are weighing heavily on our nation's healthcare system.
A lot of our morbidly obese patients have conditions like high blood pressure, diabetes, or sleep apnea. What that means for the patient is they have to go to the doctor for these conditions on a pretty regular basis. It also means that a lot of cost is associated with these visits to the doctor or any kind of medications to treat these conditions.
For many, diet and exercise aren't enough. Specialists at Pacific Bariatric Surgical Medical Group, in conjunction with Scripps Mercy Hospital, have perfected gastric bypass surgery, performing nearly 9,000 successful procedures to date.
Divided Roux-en-Y gastric bypass is where we divide the stomach with staplers and then reconnect it with a piece of small intestine. This makes the stomach smaller and makes the opening smaller, so people can only eat so much. They can't eat very rapidly, and they lose their weight.
When patients lose a dramatic amount of weight and go from morbid obesity to near normal weight, their lifestyle and quality of life improves dramatically. From a health standpoint, our patients resolve their diabetes, their hypertension, their sleep apnea, and their joint pains.
When patient Shelley Martinez decided it was time to change her life, she turned to the expert surgical team at Pacific Bariatric.
The more I read about Pacific Bariatrics, the more I talked to people who had been to Pacific Bariatrics, I heard nothing but positive and good feedback, great results.
Pacific Bariatric creates lasting solutions for permanent weight loss. Patients reduce health risks while rediscovering self-esteem and a renewed passion for living.
We work with Pacific Bariatric because it's a very experienced team, it's a multidisciplinary team, and we know that the patient is safe there. A lot of the other groups around here have started doing bariatric surgery just recently, and there's just not that experience behind it, and therefore I feel the patients are safer here with Scripps Mercy and Pacific Bariatrics.
One of the most important things for a patient to do when they're choosing where to go for a gastric bypass is to look at the outcome data from that particular institution and from that particular surgeon. The safety of this operation is everything here at Pacific Bariatric. And everything we do is designed to give our patients state-of-the-art safety and allow them to have a smooth recovery. This is a big operation and we take it very seriously. And throughout the country there's a wide variety and variation in the outcome data from this operation. And at Pacific Bariatric, we feel we offer the safest operation that is possible.
Every time I've come in, everyone has been very supportive and kind and knowledgeable, very willing to answer my questions. And the fact that they'll hold your hand and do what you need them to do and get you through the process easily has been phenomenal. A support group is essential. You can work on our stomachs, but you need to work on our brain. That's what caused a lot of the problems that most obese people have. And support groups are the #1 thing that will help you survive and get through this.
The future is probably going to lie in advancements in the laparoscopic procedure. The better instrumentation that we get, the better staplers that we get, will make it a faster procedure and make it easier for the patients. Also, probably less time in the hospital and therefore a shorter time of recovery.
There have been fads and other techniques that have shown up on the horizon in surgery that we do not employ here because we use good judgment and our clinical expertise to determine which of the new techniques are going to really benefit the patient and provide added safety for them. Our group has always raised the bar of safety nationally, and that's what we're known best for at Pacific Bariatric. And that's why our reputation for safety is unexceeded.